Good morning, everyone. Now, welcome to my 15-minute reading. And today we are going to read our national news from Khmer Times, Khmer Time News, that published on the 14th of September 2020. Okay. New COVID-19 case after almost 2 weeks, written by Khmer Times. After having 2 new cases for nearly 2 consecutive weeks, with all patients recovering and discharged from the hospital, the kingdom yesterday lodged the latest case, a 54-year-old British man, raising the country's total to 275. In a statement issued yesterday, the Ministry of Health said the patient traveled from the United Kingdom through the Netherlands and transited in South Korea before arriving in Phnom Penh on Friday. His specimen was diagnosed with Covid-19 by the Pasteur Institute yesterday. He is receiving treatment at the Khmer Soviet Friendship Hospital in the capital. The 73 other passengers on the same flight with him, including 21 women and 3 children, tested negative for the virus. They have been placed in a 14-day quarantine. Of the group, 54 have been placed in hotels in Phnom Penh, and 17 have been placed in Royal Air Force Quarantine Center, and 2 diplomatic officers have been placed in the German embassy, the statement said. The passengers included 20 Cambodians, including 6 women and 1 girl, 7 Germans, 1 woman, 21 South Koreans, 4 women and 2 girls, 1 British man, 4 Swiss nationals, 1 woman, 1 Portuguese man, 12 Americans, 6 women, 1 Serbian man, 1 Japanese woman, 3 Chinese, 2 women, 1 Australian man and 1 Austrian man. Commenting on the latest case, Health Ministry spokesman Van Dien said this shows people should be more vigilant and strictly follow the Ministry of Health safety measures to prevent new infections as the government strengthens measures to prevent transmission from both external and internal cases. We must remain vigilant to protect ourselves, as the risk of transmission to Cambodia remains due to the global spread of the virus. The virus is spreading rapidly, and the mobility of the world's population is increasing day by day, she said. Van Dien said the success in preventing transmission in 2 local communities by the Ministry of Health is due to its 5E strategy. E1 Early detection, timely detection of positive coronavirus. E2 early contact tracing. Continue to search for suspected COVID-19 transmission network in any group or suspected location that can be transmitted from person to person, she said. E3 Early isolation. When we find suspected cases of coronavirus, we have to isolate them. E4 Early treatment. When we find people with COVID-19, we have to send them to get treatment at a public hospital as soon as possible. And E5 Early prevention. Take precautionary measures to stop transmission of the virus to any individual. Last Friday, the Ministry of Health reported that the last remaining COVID-19 patient, an 18-year-old Indonesian male, had been treated and discharged from hospital. Meanwhile, authorities have still not found two Chinese men have escaped on Wednesday from a quarantine center while awaiting test results from COVID-19 upon their arrival at the Phnom Penh International Airport on the 8th of September. Authorities identified them as Jiang Jiaji, 23, and Zhu Jun, 32, who arrived in Cambodia at 11 a.m. on September 8. The men were in quarantine at a hotel in Phnom Penh. One Din said that the authorities are still looking for the Jew, noting that they first tested negative for the virus but needed further quarantine. Phnom Penh Governor Khuong Sreng said yesterday the authorities had found some clues in connection with the case. We have arrested their accomplices who took the passports, and we are working with the suspects to find the whereabouts of the two Chinese, he said. Sreng said the authorities would step up security and implement COVID-19 measures more rigorously. He said that the City Hall has signed agreement with 10 hotels which require them to be responsible internally, and the authorities are guarding the outside to prevent people from fleeing. Colonel San Sokseha, the Phnom Penh Municipal Police spokesman, told Khmer Times yesterday police have been trying to trace the two men since they fled the quarantine center. The Health Ministry will release more information on the case as it develops, he said. Cambodia's total of 275 COVID-19 cases, including recoveries, comprises 174 Cambodians, 41 French, 17 Chinese, 13 Malaysian, 8 Indonesian, 7 Americans, 6 British, 3 Vietnamese, 3 Canadians, 1 Belgian, 1 Indian, and 1 Kazakh. Since the first case was detected in Pricehano province in late January, the COVID-19 pandemic has hit 13 provinces and the capital.